Well, breaking news again today. President Trump will be discharged from Walter Reed Medical Center. And of course, that is the biggest news right now. A lot of people are pissed and a lot of people are happy. So whatever political camp you subscribe to, knock yourself out, okay? That's not what we're here for. We're here to discuss about what do you do as a physician and how do you discharge a patient, whether you admit that patient to the hospital or whether you are treating that patient in the outpatient world. So I have done both, so I can share a little bit of my experience with you on how do you actually discharge a patient home after they get COVID pneumonia. And as the outpatient primary care, how do you tell people to isolate and quarantine? What are the timelines and criteria for that? So let me start with the outpatient world, which is a little bit easier to deal with. So most of the people who got infected with COVID-19, most of them do very well. 99.5% of them will survive with no difficulties. And if their symptoms are mild, a little bit of nasal congestion, sore throat, a little bit of cough, they may feel very fatigued. They have joint pain, muscle pain. They lose the taste of the sense of taste and the sense of smell. And once we swap them with a PCR test and it's confirmed COVID, then I would go ahead and tell that patient, listen, you got to stay home. I'll write you a letter. I'll write you a note for your employer to know that you got COVID-19 and you stay home, you quarantine, meaning that you are getting away from people as much as possible. And unfortunately, if you share the same house with somebody, if you have to be in the kitchen to get food and you happen to have your family members in the kitchen, then you should be 8 feet away from them with a mask on, and your family members or your loved ones got to have a mask on. And you avoid touching them and breathe on them and cough on them and sneeze on them. And the CDC guidelines are very clear. After 10 days of quarantining, 10 days, and towards the last 10 day number 9, day number 10, if within that 24-hour period, you do not have any fever. And again, a fever is a definition of 105 degrees Fahrenheit and above. If you don't have any fever without the help of any fever reducer medication, meaning NSAIDs, Tylenol, or Aleve, you don't take any medication to help you out, and you remain afebrile towards the last 10 days for 24 hours, and that you don't have symptoms. So in the past, they minimized it down to cough and short of breath, but that got extended out to muscle pain, joint pain, loss of taste and smell, abdominal pain, diarrhea. If you have no symptoms, have no fever within the 24 hours of the last 10 days, then you can stop quarantining yourself and you can stop isolate yourself. Now, that doesn't mean that you're going to go out to the grocery store and start laughing and sneezing and go about your business without any type of precaution. You still need to put a mask on. You still need to get away from people at least 8 feet. And obviously, the mask will help you from stop propagating the virus. So that is for the outpatient world. And also, we do not do test-based strategy anymore. So several months ago, we used to test patients after 10 days to make sure that they don't carry the virus, or when the test becomes negative, then they can resume work or school. We don't do that anymore. We really follow with symptoms. If the patient doesn't have any symptom whatsoever, there is no need to retest the patient using the PCR for the COVID-19. So in the old days means several months ago, we used to swap them at week number 2 and then week number 3 until the virus is clear from the nose. Well, you don't do that anymore. As it turns out, in my office, treating these people with SARS-CoV-2 or COVID-19, they would have a positive test for weeks. I actually had a patient, she remained positive for about 2.5 to 3 months after the day that she confirmed to have COVID-19. Now, why is it that we don't follow the test-based strategy anymore? And the reason for that is after the COVID-19 infection, you would continue to have viral shedding. So you still have the fragments of the RNA of the virus. And that fragment of the RNA is detected through the PCR test. Now, that does not mean that you're contagious. Okay, so after 10 days, if you have no symptoms and if you have no fever, you're technically considered non-contagious. Okay, so we don't test and follow viral load in the nose like we did before. We don't do that anymore. There are certain cases that are exception, but by and large, we don't do test-based strategy. Now, for the inpatient world is a little bit more complicated. So first of all, people who are admitted to the hospital for SARS-CoV-2 or COVID-19 pneumonia, first of all, they have to have symptoms more than just a little sniffle, a little short of breath, and a little cough. They have to breathe very fast. That's called tachypnea. Usually it's above 30. They usually have hypoxia, means that their oxygen saturation in the blood drops down below 94. So 94 is a cutoff, but of course, the older you are, the lower your natural saturation is. So a 90-year-old patient does not have the same saturation as an 18-year-old patient, okay? But by and large, when you have hypoxic episode where the oxygen drop down below 94% on room air at sea level, you're breathing over 30. You have findings on x-ray that covers more than 50% of the area of your lungs. You have a sign of low blood pressure. You look ill. Then those are the criteria to admit you. Now, there's more than that, which we don't have to go into details, but by and large, those are the main ones. And you would get treatment in the hospital for COVID-19, pneumonia. And how do doctors know when to discharge you? Well, it's not really just looking at the chest x-ray or the CT scan. It's not really just looking at the lab numbers, okay? We follow the patient clinically, meaning that the patient appears well, able to eat, able to drink, able to ambulate. But more importantly is when patient ambulate, their oxygens do not drop, okay? So we call that exertional hypoxia. So if they don't have any dropping in their oxygen in the blood, the moment they get up and walk around, and I usually ask the nursing staff to walk the patient around the unit, and if they are able to do 2-3 rounds around a unit, and obviously we're talking about a reasonably small unit, not a huge corridor, which is a lot of distance to cover. But if patients are able to walk around the unit once or twice or 3 times, and in doing in walking, we keep a post-ox on the patient's fingers. And if they don't drop the oxygen, it means that they're pretty solid at baseline. So they're able to maintain the oxygen level with exertion. They have no fever. The blood cultures come back and there's nothing grow on there. You look at their labs and their kidneys are stable, the liver is stable, their electrolytes are stable, their blood pressure is stable, their vitals are solid. They're able to void, okay? So if they're able to urinate, they're able to have bowel movements, that would be a plus. Then the patient is clinically stable enough to be discharged home. So inpatient hospital medicine is a little bit more complicated than outpatient. So if the patient is admitted to the hospital and they're immunocompromised or they were severely ill because of COVID-19, then what changed in terms of discharge instruction that you give the patients? Well, they would go home and instead of isolating themselves and quarantining themselves for 10 days, they would quarantine themselves for 20 days, okay? So what is going to happen to President Trump within the next several days as he goes back to the White House? First of all, the medical capabilities of the White House is certainly more than our regular residents, okay? He has doctors who are in there 24 hours. He has a team of nurses in there. He has, I've been to the White House twice, okay? So inside the White House. And they have all kind of facility that you'll be surprised what kind of medical capabilities they have. So apparently they have an entire section that appears to be a clinic in the basement of the White House, where they have dentist chair, they have an operating theater for small procedures. They have a clinic down there equipped to take care of him. So they have to monitor his vital signs very closely within the next several days. As I mentioned about the cytokine storm usually happens within the first 5 to 7 days after the COVID diagnosis. So we know today That's his vital signs are very solid. He's afebrile for more than 24 hours. He's not taking any fever-reducing medication. He got 2 rounds of remdesivir IV. He got the Regeneron antibodies cocktail. He got dexamethasone, and he will be getting a third dose of remdesivir IV before he leaves Walter Reed today, and we're getting a fourth one when he gets back to the White House, probably tomorrow. So they will watch him very closely within the next several days for signs of any potential decompensation. So they're going to watch for oxygen saturation, his blood pressure, his vitals. Is he able to maintain mental alertness, or is there any confusion? They will look at the way he responds to this medication. And so far, from what we got from the report, he has virtually no side effect from this medication, which is good news. So that is what's going to happen next. In terms of, is he going to be able to resume his schedule to continue campaigning for his election? So just like anybody else, if he is able to remain symptoms-free for the next 7 to 10 days, and he has no fever and he looks clinically well, he can resume his campaign trail. Now, we found out today that Dr. Contley actually mentioned Dr. Contley is the president's physician. They are actually going to follow viral load on the president. So I assume they continue to test him for the viral load using PCR. There's all kind of worry that the president is around hundreds of people, and is it going to be safe for people to be around him? Just like satellites orbiting, around him, is it going to be safe for those people taking care of him and work around him? So I assume that this is the reason why they want to show the public that he is not having any further infection, but the viral load in the nose is really not the indication, according to the CDC, to follow his clinical course. So these are the brief update on the discharge criteria for both the inpatient and outpatient world. And again, these are the facts from the CDC and the current practice guideline. These will change as more we find out about COVID-19. I've been dealing with this since the beginning, and as things change, I will report to you as soon as I know new information. So again, stay safe, wear the mask, stay 8 feet away from people, don't play with the mask, and wash your hands.